Good afternoon, everyone. Welcome to this session about community-based epidemic and disaster preparedness. We meet today at a time when health emergencies and climate impacts and social inequities are on the rise, creating mounting challenges for our societies. While national systems are essential, it is the communities who has lead the frontline systems and responses, acting first, adapting quickly, and relying on trust, local knowledge, and innovation. This session, we will explore how community-based strategies rooted in science, technology, and innovation can strengthen health systems and reduce vulnerabilities. We will look at how these strategies can bridge critical gaps in early warning, surveillance, diagnosis, and responses, particularly in the context of climate crisis and emerging diseases. Using experience from Brazil, Africa, and Europe, we will highlight the integration of community-led approaches into health systems to build resilience, promote equity, and ensure rapid response during crisis. We are fortunate to have with us distinguished speakers, and we'll start with Fernando Carneiro, who is a biologist, specialist in health and environment surveillance from the Federal University of Rio de Janeiro with a Master in Environmental Health, a PhD in epidemiology, and postdoctoral degree in sociology by the University of Coimbra. He is a researcher in health and environment at Fiocruz, Ceará, and member of the Health and Environmental Working Group of the Brazilian Association of Public Health, Abrasco. So, Fernando, the floor is yours. It's here.
Okay. A microphone, okay? Yes. Good afternoon for everyone. I can't put this through. Okay. Greetings. I'm going to present the research called Popular Health Surveillance Serves a Strategy to Strengthen the Initiative of Health System in response to public health emergencies linked to climate change. This research was supported by Alliance for Health Policy and System Research of WHO and the Program of Emergency of WHO2, and led by Fiocruz, with President's support, Presidents of Fiocruz. Well, introducing my presentation, I'm going to give some context about Brazil health system. Brazil health system have a universal system. In Brazil, health is a right. It's a right for all, and a duty of the state. In this map is the Fiocruz units around the country, and Fiocruz, my institution, like Paulo Gadelha, Daniele, have a many functions like information communication, postgraduate, story of science, education, health surveillance, healthcare, environmental health, vaccines, research, innovation. Esse the context, institutional context of our research. Well, the key concept of my presentation is this concept, popular health surveillance. In the context in Brazil, emerging in the context of a governor denialist, anti-vaccine, in the context of the COVID pandemic, the communities organized actions in defense of their lives. In the context emerged the popular surveillance practice in Brazil. A major characteristic of this surveillance model is the emancipatory perspective. The communities produce data with control over the entire process, from generate to analysis and implementation of the actions. But the term popular in Brazil is different in popular in English, because in English popular the meaning is famous, but in Brazil is different. Popular, the meaning is about a critical point of view. Representing in Brazil the Paulo Freire knowledge with the term popular education. It's very strong linked with the social movements. This book is a classical book about this knowledge. It's pedagogy of the oppressed. But when we talk about surveillance and social participation, you can make a scale about emancipatory potential. An example is the health community surveillance by WHO in Africa is very strong, this approach, but has a organic relation, the leaderships and the health system. When we come for popular surveillance, there is a more scale of autonomy and emancipatory power. Well, our synthesis about this experience in Brazil, our conclusion about emancipatory attributes of popular health surveillance. In this case, 4. Generate and manage data with control. Use of social technology for data collection and communication, not only accessible, but social. It's very strong in Brazil, this perspective, social innovation in this context. Articulate academia, health service, and popular movements from the perspective of knowledge ecology by Santos. The dialogue of the popular knowledge with the scientific knowledge and make another knowledge with strong to change realities. It's our question about our research. How popular health surveillance can enhance health system actions in response to climate emergency. And the 2 major objectives was develop strategy and instruments and strengthen governance structure for public policies. What's our methodology? The study had 3 phases. The first stage, which has the project improvement happening a national workshop. Paulo Gadelha is in this photo, in Fiocruz, Ceará, in northwest of Brazil. The second stage, we carry out a field investigation about climate extremes and PHS. Finally, the stage 3 include a field data evaluation and a draft of a future guide, Popular Health Surveillance Guide. I have this guide, the one in Brazil. It's in Portuguese, but when you have interest about this, and you make another guide, this in English, about these streams, né? Emergency climate and these streams. In this case, we develop investigative techniques such as exploratory visit, recognition the territory before the start the workshop with the communities, to talk with the people, to see the territory, the way of life of the people. After we organize a culture cycle by Paulo Freire methodology, participatory mapping, it's very accessible technique, and an action plan to mitigate climate change. Like a Nuno was talk about this. And another techniques, participative human camera and photo voice. Today, the cellular it's more accessible for everybody. About our insights and experience. Some learners about this the participatory technique incorporated into PHS, in popular health surveillance. The engagement of popular researchers, it's a concept, very big potential. Popular research, because the community is not only an object of investigation. The community is a subject of investigation. We research not about only, we research with the community. It's a big difference, this approach. And integration of artistic and cultural expression. This picture, it's an artist. We work with us in the entirety of the process. Artistic is and involvement through the entire research process, national, international experts, the Minister of Health, and representative for social movements. It's very strategic to work together, specialists, health system, and social movement, the three actors. And some results. In this our research, we investigate two emblematic cases of climate stream. It's indigenous people, village, in Ceará, northwest of Brazil, in some territories, like some territories in Africa, are similar in some cases. And we make the participatory mapping in the action plan. The interest is when finish the work, community have the results immediately in real time in the map. They investigate, bring to the university, months after the result return to the community. No, it's the result is given in real time to the part of the community. It's the case of drought. Aqui, some pictures about these people. Né? The principal problem is the access of water and quantity and quality. It's the birds' migration for better condition of the climate. And another case is a case of flooding in Rio Grande do Sul. Rio Grande do Sul, in a tragedy 2 years, no, a year ago, and it's a landless movement, a settlement. There have the big area of organic production of organic rice in the Latin America, and it's a community climatological station for the community because the farmer neighbor is spraying pesticides, and the cloud of pesticide go to the community, right, to strengthen the agroecological production. And the community, in partner with Amigas da Terra, Friends of the Earth, make this station, community station climatological. It's examples of this territory. It's in the emblematic case in Brazil, the caramelo horse, like the polar horse, is our symbol about the flooding in Brazil. It's for us, it's very important, not only the content, but the form. Because the communication, the translation of the knowledge for the community or for the base of system is fundamental. So like this guide, you have poetry, pictures, photographies. An alphabet people can understand something about your message. And about governance. 3 minutes, okay. This work, the technical contribution for the presidency of Fiocruz in the cabinet of Minister of Health about this experience. Advocates for the creation of technical group of popular health surveillance in Minister of Health, and a recognition of our project created by Idea Labs of the WHO PAHO Health Ministers International Conference of Climate and Health in Brasilia. Some products deliveries about our project. This research already delivered some products such as reports, videos, papers, and come a future PHS guide. The PHS guide cover, reports. This video in YouTube was in English. The traduction of the first national workshop. Well, this work, it's very important, the 3 segments. Né? Academy represents health system in movement. Then Fiocruz, there is a lot of sectors of Fiocruz involved. Health system, the municipal, state, and federal. And social movement, indigenous, camp, peasants. And work for this is necessary a big team. Então, it's the research team of our project, technical Minister of Health, and popular research of landless movement, popular research, indigenous popular research. It's author with us in articles, reports, guides. The authors is not only the academic or technical people. Thank you for your attention.
Thank you very much, Fernando, for bringing us with this very good information and also how Fiocruz is working with communities and that have been a long history that Fiocruz is connecting with communities together with the Ministry of Health, together with the social movement to bring together knowledge and develop solutions for specifically tailored for that specific community. And for those who just arrived, I would like to explain the term popular. Popular is not famous, is something that came from the people and together with the people. And that's why, and it's a way that we better express something that comes from the people in Brazil. So it's something popular, it's something from the people or for the people. So I would like to introduce my next speaker, and now we are going to travel to Africa, from Brazil to Africa. My two next speakers are from Africa, and they are going to bring a little bit about the work that have been done here on how this participation of community can better prepare them for disasters. So I would like to invite Ernesto Massigui, who is who holds a degree in communication and rural extension and brings over a decade of experience in disaster risk management and reduction. He has focused on strengthening community resilience through creation, revitalization, and implementation of local schools disaster management committees, as well as the development of comprehensive emergency plans covering prevention, mitigation, preparedness, response, and recovery and reconstruction. So Ernesto is from the Red Cross Mozambique. The floor is yours. Thank you.
Thank you, Danielle. Good afternoon, everyone. My name is Ernesto Massigui. I'm project manager Mozambican Red Cross, and I'm based in Maputo. It's a great pleasure to be here and share our experience as Mozambican Red Cross, and I would like to congratulate the organizer for this conference. I will talk about community preparedness for disaster prevention and response. Our G-STIC project are based in southern of Mozambique, in Inhambane province, in the district of Inhasor and Vilanculo. Both those districts are geographically vulnerable of cyclone and drought. This project are funded by Flemish government. And our key components are disaster preparedness, early warning system, and livelihood. I would like to share a small video, no more than 3 minutes, to give opportunity to you to have overview about our action on the community.
A província de Inhambane, em Moçambique, é rica em cultura, natureza e é amplamente reconhecida pelo seu espírito comunitário. Mas também se encontra na linha da frente dos impactos adversos das mudanças climáticas. Desastres naturais, como ciclones e secas prolongadas, ameaçam os meios de subsistência de milhares de famílias. Para melhorar a capacidade de resposta, foi implementado um sistema de alerta precoce em parceria com o governo moçambicano. Por meio de mensagens SMS, as comunidades recebem avisos meteorológicos que lhes permitem reagir com antecedência. O projeto também fortalece a segurança alimentar, criando clubes de agricultores e fornecendo formação prática em compostagem e uso de pesticidas naturais.
A Cruz Vermelha apoia em questões logísticas e, junto com o CSIR, planificam atividades de formações para poder apoiar as comunidades. Depois dos treinamentos, a Cruz Vermelha apoia os clubes de agricultores com insumos e com ferramentas.
Estamos a treinar os comitês sobre uso e manejo de pesticidas orgânicos, visto que os pesticidas inorgânicos são muito caros e danificam o solo e as culturas. Treinamos estes clubes de produtores, este grupo de produtores, no uso destes pesticidas orgânicos, para que eles possam combater as pragas. Usam métodos locais para combater as pragas a nível local.
Já lá, ibonga maningi porque kama lo a Cruz Vermelha ingana ngasichikele lumu abantu bali kama hlokomani abakuhupenga ukuhita lumu machongweni xa sweswi va tlhela va ku ichukwana ku hino yingena ku na swa hamayi amavito ya 33 wa vanhu va membro hi ri makulo
ha vona ku cinca ka hombe loko Cruz Vermelha yi nghenile lomu ka mahlokomani hi leswi nga hanyisa byo tala hi cincile ha ku savona leswi nga hanyisa byona a bya hi byona hi hanya lo hina ni vutlhari ha swa ku ta moya hi mahayini hi ta ku ta ndlala hi mahayini yi binsi bya hombe ngopfu
Hina chivuni cha komunidadi ya lomu ka mahlokomani loko ku nghena swijusa swa ntumbuluko hi malebyi bya ku hi tlherisa xitshungu a ku loko ku ba moya xi nga cijusa nompodi hi humahuma nompodi hi tsika vanana va famba kwalquier de manera la ndleleni nompodi a ku hi cidalana.
Com educação, mais meios, preparação e ação local, as comunidades de Vilanculo, graças ao Governo e à Cruz Vermelha, estão hoje mais resilientes, mais fortes e mais unidas, prontas para alcançar um futuro mais sustentável e seguro perante as mudanças climáticas.
Thank you. This is a yeah. Well, that was the small video demonstration. What do we do with the community in order to prepare them to facing disaster and the drought? In terms of disaster preparedness, we created and training 8 local community disaster management. Those groups are composed by 18 members. We created them and we equipped them with tools like ambulance, bicycle, radio, life jacket, and another materials. As you can see in the picture, that is one local disaster group that work together to the community. And those groups have tools to work with them. Some of those tools are, as you can see in the picture, the tree map. That tree map are drawing with communities and other people of their communities. This is a small representation for local communities. Here we can find infrastructure and the market, church, but the thing that is important in this tree map is how the community can easily identify safe zone and risk zone. When they are affected by floods or cyclone, they know the evacuation routes that they can following to achieve a safe zone. It is represented in that tree map. Other tools of this local community disaster risk management is action plan. This action plan, we can find the activity that the committees can do after, during, and before the disaster. But after them, the community make an event of history and make a risk analysis to identify what the disaster are frequently happening in that community. In order to have a action plan with the activity that can help them to implementing or development action to make the community safe by disaster. In terms of simulation exercise, that is another tool the community use to show or to test their preparedness to facing a disaster, but also they demonstrating how can they this is demonstrating how can they facing the disaster if it affects the community. In the picture we have there a lady, it's a volunteer of Mozambique Red Cross. Then we have ladies with orange jacket. That is a member of local community disaster management. They work together as a part of community. In terms of early warning system, what I should like to highlight here is when we are when we would like to have a community that are prepared, we have anticipatory action in early warning system. We use networking that includes radio, community alerts, sensor, electronic sirens, hydrometrical scales, telemetric station, and data winner. But those networking, all of them, the main objective is to give information before the effect of disaster, in order that the community can prepare and maybe leave the risk zone to the safe zone. This is a diagram that shows how the information flow to the government, INGD, who is a sector of government that coordinates the disaster management, and the information ascended by the province and the district and administrative post until the communities. When is there that the local communities are based. So they are first group facing a disaster after the government go there. So those actions is to give them a capacity to respond or prevent the impact of disaster. In terms of agriculture, we has the Mozambique Red Cross with partnership Belgian Red Cross funded by Flemish government. We create and training 8 small group farmer and we train them with conservation agriculture, sustainable management. As you can see in this picture, there is a demonstration how they can sow, how can they sow and they put dry grass in the soil to protect and for measuring. So we do this in Vilancourt and the Inhasoro district. So it's small product, but give them how can they use natural biopesticide inside using meshical that we believe that is can damage the soil and they can compromising their health. Because those small farmers group they practice substance agriculture with a few resources. So we allocate tools and seeds. In the past dry season, we allocate seeds, beans, cassava cutting, sweet potatoes, and in the cold season we locate vegetable. And this was the last slide that I was shared to you. Thank you.
Thank you so much. So we saw in these 2 presentations one of the main soul and idea of the 2030 agenda, which is do not let no one behind. And those people are already living in a very vulnerable vulnerable condition, and they need to be also listened and to be cared, and that's how we can build a better and resilient system and communities, so we can bring their knowledge and we can bring our knowledge, and so we can bring solutions, and Red Cross is not only doing this, but you are also equipping them with materials that can help them to drive into this disaster. And now I'm going to pass to my next speaker, who will talk a little bit on maybe how to make it in a upscale, in a national scale. So I would like to invite Nunu Remain, who is the Executive Director of DINSUR. Nunu is a Mozambican leader in disaster risk management, urban resilience, and sustainable business development. He served as Executive Director of DINSUR, which is the Technical Center for Disaster Risk Management, Sustainability, and Urban Resilience for Southern Africa, a sub-region, a political entity founded in 2013 by the government of Mozambique, Madagascar, Malawi, and the Union of Comoros, with the support from the UN Habit. The floor is yours. Thank you so much.
Good afternoon, everyone, and thank you for the presence. Thank you for the previous presenters and presentations. This shows basically that community-based solutions are key when you deal with the climate change projects, especially when the theme is related to this type session, which is community-based epidemic and disaster preparedness. So if you engage with community properly, we believe that the success of the projects, it's 100% possible. We would like to share with you our experience. We've been implementing a project funded by the Adaptation Fund from 2020. We just ended this year, and this project was a $14 million project implemented in Mozambique, Madagascar, Malawi, and Comoros. And the basis of the project was the improvement of resilience within these 4 countries, in 1 city per country. This city was chosen based on the disaster facts that they did have with local and national governments. As Daniele said, we work in a level a little bit different. We don't work in a local, neither the national, we work in a regional level. But what we do is we try to engage all the projects from the national and local perspective, put them all together and make cross-fertilization in between the countries based on the results that they achieve during their implementations. I'll not lose much time presenting DINSUR and myself. I'm a Mozambican, work for this institution since 2022, and DINSUR was created by these 4 countries previously mentioned, as an institution that would try to improve the resilience in the countries. One of the key objectives, we always mention this because we think it's very important, is not only the dissemination of technical information, that is this what we're talking about here, but the inclusion of communities, also the engagement of governments, that they would sign the paper at the end of the day saying that institutions like ours can or cannot be into these places implementing projects and promoting the local communities, and as a consequence, of course, the local governments. We are a big team spread a little bit all over the world. These 4 countries are our main base, and we have at least 1 office per country, and we are directly linked within the disaster risk management institutions or ministries within these countries. One thing that is important is DIMSUR is a diplomatic institutions which facilitate a little bit the contact with local governments. So we do, I think it's key to say that we do a top-down approach, but we engage especially bottom-up when we want to develop our projects, but already with the agreement from the top. We are linked to academia, more than 30 universities across Africa, in fact, almost 50 now. We are linked to centers in Asia like AIT and ADPC, the biggest centers of disaster risk management. And the 4 countries are in the region of SADC, which is the region we are now. And it's a region, African region, Sub-Saharan African region with 16 countries that we develop projects directly in for. So for this session, I would like to speak about our lessons learned within this project of the Adaptation Fund, but what we intend to do within this project. We are trying to change the narrative of reaction to prevention. That's what we're trying to do, and why we're doing it. I was speaking with the colleagues from Red Cross before the session starts, and there is first one point is that on the Agenda 2030 predicts that within less than 10 years we will be having 50% of the population of the countries living in cities. So this exodus, it's something very, very, very scary, because infrastructure will not develop in the same as fast as this exodus. This is one. And the second one, it's changing reaction from prevention. Sometimes, I would say in African countries, but this is not true because it happens a little bit all over the world. You would be changing something that brings for the governments $1 instead of 19. What I want to say, if you invest in prevention, for each dollar in prevention, you spend $19 in reconstruction. So it's gaining $18 less of what you gain if you prevent a disaster. So it's a contrasense for us, trying to advocate for a solution that brings, into commas, less money to governments. But why less money? Because you spend less, because you can maintain more, because you can have people advised, because you have less destruction of infrastructures, and you have a cycle of life that will be an improvement of situations and not a decrease of situations. So this is why this is our narrative, the change from reaction to prevention. So, and how to do this? The 2 previous presentations that we did had had exactly the same focus, which is participatory planning. Engage communities since the beginning, helping them to participate, themselves designing the mapping, themselves identifying the risks, themselves creating the solutions. But we would go a little bit further down when we say that communities must be included when we make a project planning, especially on the financial side of it. Nobody includes communities when they have to say how much the project will spend and how the project will spend. This is a result after 5 years of implementation of projects in 4 countries. This is a lesson learned for us. We had fantastic results, but we do see that if we had engaged with the communities while we were designing, telling them we want to spend this amount of dollars to do this amount of actions, I believe that our results would have been better than the ones we do have today. But the main purpose, it's share technical knowledge generate community ownership, because what you do want as a result is a community that owns the project. If they own it, they will defend it. If they own it, the project is not yours, is not from the government, is from them. So changing governments, changing teams, having the technical expertise, passing from trainer to trainer, guarantee that the knowledge and the expertise stays at the community. This is our main focus, is the communities. And we developed with the United Nations, with the UN Habitat, the tool called CityRap, and CityRap is a participatory planning tool implemented in almost 40 cities in Africa, 50 cities in Africa almost. But what is interesting about this tool, it's that it's not only it's a participatory, that the three of us, we spoke about communities participating, but it does one thing that I think it plays a major role on top of participation, which is prioritization. So you put people to participate, identify risks, identify and create solutions, but what we would do best is tell them, for the minimal amount of money that we do have, what would you prioritize as your first, second, and third solutions designed by you to implement? Because we have a lot of problems, but we don't have a lot of money. And even if we did, the problems has not the same priority from one person to the other. So what we do is we try to engage one voice, communitarian voice, and the creation of ownership must be in the same level of the creation of priorities. So if we have the same priorities, we own the project the same way. Okay, and these are my institution. The lessons learned we did had, they are very, very, very focused on what the community brought us back, not mainly on what governments did, but of course there are some important facts. Effective participation of member states. Here we're talking about the owners of DIMSUR must participate more. It's not because it's a cross-cutting institution and a multi-government institution that government B must invest more than government A. So they have to participate to own, they have to participate to ask questions, they have to participate, they have state budgets, and in the state budgets they have budgets for disaster risk management. So participate must be in the same level of paying something. For now, DIMSUR is an open institution, nobody has to pay to participate, but within the state budget, we know that there are money for disaster risk management, sustainability, and urban resilience. The second one, it's when we speak about beneficiaries' participation on the design of projects, we just presented 2 presentations before mine and now mine, that you include communities in the design of the solutions. But on the project proposal, the proposal that you would submit to a donor, do you really include the communities on this? I think the answer is no. So this is a lesson learned, because at the end of the project, we heard people saying and commenting, if we knew that, and it's for me key, it's not the entire community. The community has representatives, but these representatives on the higher levels that they are, I think they should participate on the project proposal, even with statements made by their own. This is the beginning of ownership. The third one, it's the inclusion of hierarchical leadership structures in communities, and here we're talking about indigenous knowledge. If we go back to the time of our great ancestors, with no scientific developed major institutions, they had factors linked to nature, to environment, that would give them back signs to react to disaster. Let's call it disaster. So this knowledge, it's so important as the scientific one that we do have today. And we forget, because in Africa we start going to school, I speak as an African, We start going to school, and the higher we go in school, the bigger we forget where we come from. And I know you agree with me. I wouldn't ask if you do, because I know you do. So this is exactly the returning point when you go back and you say, no, I want to hear the voice of my grandfather. Grandfather, what you think about this? Is said in the university that I've studied. So inclusion of indigenous knowledge for us is key. Fourth, transversal transparency in fund management. This, I would go back within the inclusion, bringing the communities in the participation of the writing the proposals and telling them how much we will have and how we would be spent. So must be totally transparent, but it's important here to comment that this can be seen as a political issue. This can be seen as a statement that wouldn't make happy many people. This can be seen as something that will deviate the process from its real value. But we think as DEMSUR that it's very important to be transparent, 100% transparent. We have researchers in this room, and I know that they are obliged to justify the cent when they do research. So why wouldn't be politicians? Why wouldn't be community people or community at the communitarian level? Why wouldn't be at the national level? So let's justify the funds we receive, because this is taxpayers' money. Someone is paying for we to engage within these projects. The fifth, it's ethnic cultural differences we must understand. We work in several countries and we've got ethnic cultural differences, religious differences, anthropological differences. Before we force implementation, we should understand how can we be better heard. How can we better communicate? We worked, for example, quick example, in Comoros, where woman doesn't have a voice. Why? It's cultural. You don't have to fight this. You have to understand, try to engage, and proactively give your thoughts. We managed to do it within 4 years. And our best implementers from Comoros are ladies, respected by their own government today because of the implementation done. So ethnical, cultural, religious differences must be understood and not fought. Permanent consultation with governments, you must get the buy-in the whole time. We've done this, we agreed this, we've done this. Do you? Yes, I do sign. So buy-in from governments the whole time. It's the way of maintaining your path clear, clean, and the whole time in a perspective of replication. Because if you get a stone in the middle, maybe we will not replicate this project. Next to it, permanent contact of project management teams. You would have them all over. Make them talk. Make them change ideas. Make them cross-fertilize. Make them talk about difficulties and not the amazing results. What about talking about difficulties? This we also learned. And we think within this project we touched directly plus minus 350,000 people with 4 years. Let's call it 4 because COVID was a challenging factor in between, but also with COVID we managed to do it. And to resume it, I would say that we think our lessons learned must be validated, but validated why? Because we spoke in 4 countries, 3 different languages, French, Portuguese, English, totally different ethnical and religious cultures, but they all implemented more than 65 to 75% of the results expected, so the KPIs were very good. And we spread this information for all of you for free. Engage with the SHIPEFO. SHIPEFO, it's a repository of information that DEMSUR has within the website, demsur.org. I know that but now we are changing something on our website, so you might have a challenge maybe today and tomorrow, but please keep the website and the SHIPEFO, and every information that you do have within your institutions and you would like to replicate in this platform, it's free to do it. Engage with us, see the partners from SHIPEFO. We've got EU, we've got Chima Foundation, we've got FAO, we've got the United Nations, we've got many key players. So you put the information there and all of them would see it. So thank you very much for your patience and attention. Thank you, Daniele.
All right, that was very inspiring and teach us a little bit on how we can scaling up these approaches. I would like to know more the details, because this is a hard mission to make government translate this knowledge into policies and also afford and embrace all this movement and work. So I would like to invite our last speaker that will talk a little bit about guidelines and instructions that is so important to communicate with the community and to pass the right information in a world that we have so many fake news. So these connections and these guidelines and media channels that can be easily accessed by the people and have a trustful source of information. It's so important. So I would like to invite Olivier Rogier, who works at the Belgian Red Cross Flanders, focusing on international first aid programs and digital learning. He leads the rollout of the First Aid in Africa app and support partnership across multiple countries. With a background in pharmaceuticals and business, he combines strategies with hand-on humanitarian impact. Olivier is passionate about using simple tools to save lives and strengthen community resilience. Thank you so much.
So good afternoon, everybody. Fourth speaker. So I hope you still have some room after all the inspiring insights of the previous speakers. So today I would like to explain a bit more about the role of the Belgian Red Cross Flanders, the way we operate, and we also work with our partners in Sub-Saharan Africa to also capture the knowledge from Sub-Saharan Africa and translate it into expertise. But let me first maybe start with an explanation about the Belgian Red Cross Flanders, because from the conference I learned if you ask 5 different people what the Red Cross do, you will get 5 different answers. But our main mission is always to drive impact for individuals. Here, for the Belgian Red Cross Flanders, I can speak that we mostly rely on disaster response strategies, self-reliance, and also ensuring a safe blood supply. And of course, as you know, for this, we always rely on our volunteer network. If you then look how we do this within Belgium, you will see a part of our activities listed here. It's also still not all activities, but the main activities. So blood service, it goes from blood collection, for which we thank all our blood donors, of course, to actually the processing of that blood, and in the end also delivery to the hospitals where it's needed the most. And then you see here also our humanitarian services, which is first aid, which is my biggest passion, also relief and intervention service, the reception of asylum seekers within Belgium, where we host the asylum centers. We also try to connect people who have lost their families along the way, coming to different countries, to connect them again with the people there. We also are a big part within the social welfare, and there a good example is also the library service we give to elderly people. It's a sort of lending mechanism where people can get books and we pass them along to communities. So they can also still have some connection moment with the person who is there, the volunteer, and also just have some time to read. And then lastly, which I'm going to discuss further today, is the international cooperation. So on international cooperation, you can see that we are working with partners all over the world, sometimes with a delegation. That means that we have people also there, but also without delegations, where we govern the projects from within Belgium with our partners on the ground there. And if you look at the expertise, as mentioned, we have a lot of expertise in blood. The entire blood supply chain is sometimes governed by blood banks, sometimes it's governed by Red Cross societies, and I can proudly say that in Belgium it's also the Red Cross who is governing this. We also have a big expertise in first aid. First aid, if you have ever had any guideline in your hand, probably it's coming out of Flanders. So also there we have a strategy on how we develop these guidelines, which I will also explain to you further on. And then also, of course, disaster and conflicts. Ernesto already gave some more background on the projects that we have together with G-STIC in Mozambique to also prepare people for disasters and floods and the mechanisms we install there. And then lastly, as discussed, we also do the tracing of missing persons. Now, a good question is, where is all this knowledge coming from? For Belgium, we have 3 research centers. The first one is the Center for Evidence-Based Practices, which I will also explain a bit more in detail later on. Here we really look at the existing science that we have today within the humanitarian domains, and we try to distill it to the practical hands-on guidelines that we have today. And we also have the Center for Research on the Third Sector. There we really focus on methodologies that we then can apply and distribute together with our network. And then last but not least is also the Transfusion Research Center, entirely focusing on blood and everything related to that. And a fun part of it is that we also develop materials, such as currently, we all had the COVID pandemic. It reached everybody. Everybody had to get needles. So now we also learned that not everybody likes needles. So we are also developing a nasal therapy with plasma, because it's a blood product. So you don't need to have a vaccine anymore injected by you with a needle, but just with a simple nose spray. So that's also part of the research that we're doing. But today I mainly want to discuss the guidelines, because this is also coming back to our community work. So as you can see, we develop a lot of guidelines. We like guidelines, and we especially develop a lot of guidelines in first aid. And we do this for societies and communities, both within Belgium, but also for other parts of the world. In 2017, we had guidelines for Nepal and India. Currently, we have a big focus on Sub-Saharan Africa, following also the good collaborations we had so far. The way we develop these guidelines is what I want to explain further on. It's a specific methodology which we call the evidence-based practice, and it's always a 3-pillar system where we always first look at the best available scientific evidence. We also look at the preferences of the persons who need to apply these guidelines, because as mentioned, if you don't talk with the communities, nobody will use it. So then you just are printing a lot of materials for nothing. And then also lastly, the practical experience from the field, the expert panels, people like you here today. To discuss it a bit further in detail, if we look at the scientific evidence, that's basically if you go on ResearchGate or any other PubMed channel, you find a lot of literature that already exists today. And then as researchers, you can do a systematic review. You try to distill all the existing information to one concrete guideline that will really benefit everybody. Besides that, if you don't have the availability of existing literature, we also do primary research where we really go into the field together with local Red Cross partners and other partners, universities, where we also collect information that we then also publish online. This information is, for example, what we've learned is to learn first aid, a person has a lot of practical knowledge he or she needs to learn. So the current model was that we always learned it in the classroom model. So people had to come to a room and you learn first aid just by doing it, and it takes around 3 days. Now with the Belgian Red Cross, we wanted to shorten that time. So we thought about a blended model. And then we also had the reflection, okay, but do people actually learn as much as they do within the classical classroom model of 3 days? And there, since we wanted to know, we tested it, and the results are promising. is as that people know as much first aid after that 1-day course. So good news. Here's an example of the expert panel and the experience we gather in the field. You here have a colleague, Irvin, together with other colleagues. And that was an expert panel that we had in Rwanda on research that we did on first aid for the development of our first aid in road traffic injury guidelines, where we sit together with experts, both related to first aid, but also related to traffic in general, what can be done and what cannot be done to capture their advice when we develop these guidelines. And then lastly, but not less important, is of course the preferences and the available research of the target group. Because if we look at a guideline, for example, for treatment of burn wounds, there is already a lot of knowledge, and people have been burning their hands. We are humans. We like to sit around campfires, so we had a lot of accidents. But we wanted to know what works and what doesn't work, because sometimes people say, you need to apply ice to cool the wound, it will heal it, or maybe even toothpaste because it has mint inside, a nice cooling effect, or even just oil, butter, or try to pinch the blisters. But if you then look at all these remedies from a scientific perspective, it might help, but it won't cure anything. So if you then look what does help, and what was also a remedy, was applying honey. Honey is a natural antibacterial methodology to also apply to burn wounds, which can help to treat them. And also, for some local communities, there's no pharmacy nearby, but what they do have is honey. So in that sense, they can also apply the honey and treat their burn wounds. Just another example, the same for snake bites. If you ever encounter snakes, do not start sucking the wound, please. It doesn't help. I know it's a thing that is often said. Also, rubbing herbs or black stone, it can only infect more the wound than it already is. And don't try to kill the snake. The snake will probably attack you back, and then there's 2 people with a snake bite. Well, but what you can do is try to calm the person, immobilize the arm or wherever it has been bitten, and try to find the person that can actually help you. If we then take a step back, because it was a long journey before we had our evidence-based guidelines, it's not something that you can just take out of the closet. It was a journey that started in 2007. And there we first developed our European guidelines that were then for 22% evidence-based. And then throughout the years, we did more and more research. We had more and more expert panels to sit together. We had more feedback of communities to work on. And with that, year by year, we had the opportunity to further specialize ourselves within the first aid. And since 2021, all our guidelines are now completely evidence-based. So everything you read today, everything that you will see from our guidelines is actually based on science, but also based on the knowledge that we gained from communities and from experts in the field. Voilà, so it's been used now in 43 countries worldwide, maybe in a country where you're also living, and in Africa, because that's our current focus, in over 20 countries. So coming back on that, I'm telling you about the different countries. It's also important to contextualize the guidelines. If you want to have guidelines that are used, you really need to engage with people and learn about what they think is important and how they wish to use it. And for that reason, we contextualize it. And what I mean with the word contextualization is that we look at the situation at hand. For example, again, the COVID pandemic. If you want to give CPR, but there's also COVID, you might have the reflection, okay, can I do something, or do I have to be afraid of COVID? But the person is dying. So what do you do in that case? Also for different ages, you have people who are still in primary school, but also they can help. They are also part of the community, and they are also willing to learn and do something if something is happening. So also for that age group, we have our guidelines adapted. And lastly, based on the region, we are also looking how we can adapt our guidelines. So today we have a certain model where we want to share all this knowledge with everybody around the world. And that's together with the Red Cross organizations that we work with every day. And the good part of being part of the Red Cross organization is that it's a worldwide movement, and we're present in over 191 countries. We have over 16 million volunteers to help us facilitate this translation to everybody who needs to know these basic first aid knowledges. And for that, we currently work with a train-the-trainer model. So I think for most of you it's known, but for those who it's not known, we have our own volunteers who are really trained professionals, who are master trainers, and they go abroad to help the local Red Cross get trained within the methodologies that we gathered together with them. They then train local trainers, and like this we have a network effect to expand the knowledge to also reach the lay people who need to be trained within first aid. And it's a model that works. Today we have reached over 11 countries within the current projects we have, and over 16,000 local volunteers became basic first aiders, so people that can really act whenever an accident is happening. But it remains a question, how can you have more people being trained? Because 16,000, it's a nice number, but it's not the entire population, of course. If you would pin it down to Mozambique, for example, I think it's just not even one suburb. So how can we reach even more people? In Belgium, if we had the same issue, we first looked at the web-based learning module, where we then had our guidelines translated in a web-based blended learning module. But then for the our other partners, we wanted to migrate from that, and we were also thinking about app development. So the good thing is, within our knowledge centers, we also have a good IT development team. So for the Belgian population, we have developed also 2 apps to reach even more people. And then in 2019, we also had the idea of an app for our partners. Then we started developing this together with the Red Cross of Rwanda, who really helped us within the development. We tried to scale it, we piloted, we iterated, because you always have to test a bit before you have a final good product. And since 2023, it's a product that we are now applying, and a methodology that you can see here. What you see here is actually the blended learning model, where we have migrated the total duration of a training from 3 days to 1 day, which also means that we can train with the same amount of trainers 5 times more people, which is a great effort. And it's also showing its effects as of this year. This year we really see growth. We really are embedding this methodology further and further along. Then some more information about the app. It works offline. It's available in local languages. It's always adapted to the environment. So the guidelines you will see in one part of the world, if you install it, for example, in Mozambique, or if you install it, for example, in Benin, there will be different guidelines if there's a cultural difference, of course. We now have it also available in an emergency mode, where people can just use the application if they are in an emergency, and they can say, okay, I see a person choking, but I don't know, or I don't remember what to do. Then you can go back to the app, have a little refresher, and then really save a life, hopefully. The other big point is what I was talking about, was the blended learning model. Here we really emphasize to have it in a blended way via an application to reach as much people as possible. And in that regard, we also have now a classroom model where people can register for a training at the local Red Cross. Voilà. So here, just some extra information about the 1-day training. Also on that regard, if you have just an app that you would need, if you look at the typical classroom, it's a lot of paper, a lot of materials that need to be printed and sorted. Here we don't require that anymore. We also adapted our methodology to suit those needs. Voilà. Here also a bit more information that we also try to commercialize it, because as you know, funding is a big issue. As the Red Cross, what do? We give trainings, so also training for companies. Here it's an interesting model because it's only 1 day, so we also help and incentivize our other Red Cross partners to work on this together with companies to have more and more commercial first aid trainings. And it's picking up. Today we have over 50,000 users. We have more than 8,000 people actually trained. And above that, we also have the emergency module. And there you can also see that over 7,000 people have used the emergency guidelines. But we don't want to stop there. It's our ambitious goal that by 2030, we want to have 1 million users all across sub-Saharan Africa. And therefore, we also look at you here today. If you have interesting ideas, please share them. Not only on the application, but also on the other expertise I've shared with you today. It's always the vision to collaborate, especially with people like you here, to work on these domains and on these topics. So any questions, feel free to reach out. And I'm giving the floor back to Daniele. Thank you very much.
Thank you so much. I think we finished with a very interesting tool and on how we can use technology to provide information, science-based information and cultural specific information. So this is very, very interesting. I would like to invite the speakers to sit in this chair so we can have a final discussion. We have just a few minutes. If someone wants to make some questions, and we are open. You have the microphones. I'll say. Okay, people are shy. Okay, I can start. So I would like to hear from you, I think Ernesto, Fernando, and also Nuno, on how can we scaling up all these community-based approaches, because we know that the work is super hard, and there is a lot of time to build trust on this community, and this is the real beauty of all these projects that you are developing. But how can we make it bigger, or how you as a manager, as a researcher, as a diplomat, how can we bring this knowledge and all these approaches that we learn together with the community to the national level, to the governmental level, so we can develop policies and programs that can be applied also in other communities? It's just recommendation. I think G-STIC is for that. We don't need to have all the answers. I think you are already working in different levels with Ministry of Health, with regional, multilateral agreements, and between these many countries. So it's just some insights from you.
Thank you, Danielle. The audience, thank you for staying. I think it's a key question, and even it's a question for us, because replication it's not an easy thing to do, especially depending on the place you're working. Mm-hmm. One of the strategies that DIMSUR uses, remember I mentioned we do a top-down approach, but also we engage with the community to make a bottom-up before we starting the project. So this guarantees us a position that we are not on the top and not at the bottom. We are in the middle. So we have the same engagements done with the government. We give them the same value as the ones we do with the community. And another thing that we discovered while implementing projects is that you cannot be changing teams the whole time, because this trust factor that you build. Yesterday I made a presentation, and the presentation, the end of the presentation of yesterday was, it's everything relied on people. It's about people, not about money, not about projects, it's about people. So if you keep on changing your teams, you keep on decreasing this trust value that you build while you are developing the project. So replication is based on trust, yes, but it's based on the continuous engagement of governments and communities, and you must keep your word, your teams, your promises. I believe this is some factors for replication.
Anyone?
I would like to join, as Bruno said, as Mozambique Red Cross, we are engaging the community. I would like to give some example. In the training of small farmer clubs, we train them, but they have a responsibility to transfer those knowledge to all communities. how can it work? We train the farmer club, and we support another community, so household. But we as Mozambique Red Cross, we don't train the household. The household will be trained by the farmer club. So this is some example that we think that even the project finished, the knowledge will be there in the community. Thank you.
Yeah, in our case, our strategy is working with emblematic case for inspired another people to make the difference, to change the word about your local, because you don't have many funds. Our strategy is the emblematic case for mobilizing the change.
And yeah, I'm thinking about also the solutions. We have a very good example, for example, in Brazil about the cisterns, where some group of people and NGOs developed a cistern to overcome the lack of access to water during the drought season, and it was built inside a community with their insights and their skills. And then the government took this solution and spread and built a lot of cisterns all around the more arid area. Yeah, that capture the rain and storage, and this can be used during the drought season by the population, and this reverts on health benefits, on many other benefits, and it's linked now with climate change as well, because it's related to the amount of rain in this region that have been also affected. So I have one more questions to Olivier. So you mentioned about all these guidelines and also how you are testing all this traditional knowledge and also trying to better understand the effectiveness of all these solutions. How is it in the multiple? And you said that, if you are in a country and you are download the app and you are going to have a little bit different, and so you tested like different approaches and for different countries. Can you give an example? I don't know if you have in mind.
Yeah, for sure. The good part of the Red Cross organization is that we also have a partner always in country. And for that, we heavily also rely on their network inside the country to capture these insights. So what we do is discuss with the first aid team of the Red Cross organization the guidelines that we have, the guidelines that we want to implement. And then we always have a panel discussion with them to also capture their feedback and input on what is culturally appropriate or culturally not appropriate. For example, undressing somebody in case of CPR, is it done? Is it not done? And there's many more examples. But for this, it's always together with the partner that we have there. It's not us going directly again to a community. For that, we count on our partners to give us those insights. So basically, the benefit of the Red Cross network as implemented. Yeah.
So if anyone has any questions, so I'm going to, yeah, okay, one question.
So yes, to the gentleman from the Red Cross Mozambique, I'd like to find out from you. You deal with climate disasters or environmental disasters. Do you have any plans in place or action plans in place to deal with um, uh, social disasters. So, in other words, I'm specifically thinking about the terrorist incursions into Mozambique currently. Do you have any plans to safeguard villages, communities against such incursions? I don't know what your thoughts are.
That's a tough,
Well,
tough
thank
question.
you. I don't know that I get well the question, but I will try to answer. I'm not alone. I'm with my colleague. Yes, there. If I'm not able to answer, I think that she can help me. As Mozambican Red Cross, we have a plan, a national plan, but those national plans are traduced main level. It's a national, but we have the provincial level and the district level. So those plans include some action to prevent the communities. Are not the community have his plan, local plan, but we have the big plan is national. This plan I don't know if you can help me, Ron.
Okay. Yeah.
Sorry.
Yeah, hello. So I'm Rune van Kleemput from Belgian Red Cross Flanders, but I'm a delegate based in Mozambique supporting the Mozambican Red Cross with their project implementations. So going back to what my colleague from Belgian Red Cross was explaining, there's a whole international movement of the Red Cross. And originally the Red Cross actually came from supporting soldiers in war and being the neutral party that offers first aid to soldiers. So then based on that original historic basis, it grew over time to include also safeguarding citizens. And first it was indeed citizens caught up in war, caught up in terrorist attacks. And the last expansion of the mandate of the Red Cross was actually to also include the care for citizens in natural disasters. So to answer your question, the natural disasters is actually the last thing we started doing, the most recent work. The conflict, and for instance, I'm assuming you're referring to the Cabo Delgado conflict. This is something where the Red Cross is also very much active. And this is mainly supported then by the ICRC, which is the International Red Cross, Red Crescent, that is the most neutral body of the Red Cross, which is situated in Geneva. But they also always implement through and with the local Red Cross. So the Mozambican Red Cross is also very much involved in the actions there.
So thank you so much. I'm going to finish this session because we will have the closed session and we need to be there. So thank you so much, all the speakers. And I think this is such an important topic that connects with all the Agenda 2030 because it connects with agriculture, it connects with climate, it connects with health and economy and so many others. So I really love to hear all your experience, and I learned a lot, and I hope this can inspire people to work more with communities and to make this change happen. Thank you so much.